Hi, I'm Dr. Peter Coleman, retired physician and addiction medicine specialist. And today we're going to be talking about the second thing that causes an addiction to develop, and that's trauma. Usually childhood trauma, but it can be trauma of any kind. I thought I had a pretty traumatic childhood. It was painful to me. My mom drank too much sometimes and took sleeping pills and got in fights with my dad, and it was very painful for me. But the reality is my trauma was nothing compared to some of the people that I saw in my practice. One of my patients, Steve, was literally beaten and locked in a basement for days at a time by his alcoholic father. I had a number of patients who were sexually abused by stepdads, and one in particular, Jody, suffered through this and finally got the courage up to tell her mother. And her mother took this new partner's side and ignored it and said she was wrong, and it was horrible. I've had other patients who were having to keep secrets because dad was having an affair. And childhood trauma comes in so many different fashions. There are a number of patterns that happen with childhood trauma. The first has been described as don't talk, because if you talk about it, it just makes it worse. If you witness, you're a child and you witness your brother getting beaten up by your alcoholic dad and you say something about it, you're going to get beaten up yourself, and it's not going to make anything better. It's just going to make it worse. So kids very rapidly learn to shut up and just be quiet about what's going on. Don't trust is the second rule, and that happens all the time in an alcoholic or in a drug-addicted family because people make promises and they don't keep them, and kids learn that the world is not a trustworthy kind of place. It's very, very sad. Don't feel, because you have these emotions inside that you know are real, but you're being told constantly that they're not real. So if kids are sitting around the dinner table and mom is drunk and slurring her words, the normal reaction would be being terrified and thinking maybe we need to call the rescue squad. But there's dad saying, everything's fine. She'll be fine. Just let's put her to bed. And so the kid learns that their feelings must be wrong. There must be something wrong with me because I know I'm feeling, but dad says this is normal. And of course, there's the reality that they don't know any different because this is what they've lived with. Kids learn to become survivors through this, and the survival techniques that they have as children sort of function, but they don't work well as grown-ups. So part of recovery then is learning about childhood trauma so that you can learn new ways of doing things that are more functional. One of the first roles that some kids develop is an overachiever. The kid tries to be super good at sports and at schoolwork and always helping around the house and taking care of things. And a lot of these kids, like me, ended up deciding to go to medical school and to become helpers, whether it's nurses or teachers or other helping professions. Another role is the troublemaker. So sometimes one of the kids will end up becoming a real troublemaker, and that actually creates some stability in the family for a little bit, because for once mom and dad are on the same side. Like, what are we going to do about him? We've got to do something. And so that actually stabilizes the family, but it comes at an enormous cost. Stress is very painful, and how does it actually set people up for addiction? Well, normal stress, acute stress, whether it's a one-time sort of thing, releases cortisol and other stress hormones, and those actually help the brain to function well and to deal with that stress. The problem is that trauma, childhood trauma particularly, is chronic stress, and that's particularly damaging for a number of reasons. One is that children's brains are developing. They're trying to develop pathways that should be full of trust and love and respect and joy and happiness, but instead they're learning these pathways of fear and lack of trust and these other ones. And so that's particularly damaging. Secondly, it's intermittent, because sometimes dad's in a good mood and he buys presents and he says sorry for what he did, and the next night he punches his hand through the wall, and the kid doesn't know what to expect. So chronic intermittent stress is very painful. Thirdly, what we call social defeat stress, where kids are literally told they're not good enough, which is a terrible thing for kids to hear. But it happens all the time in these families. And the fourth thing is that there's no way out. The poor child can't talk to anybody about this. They can't even really tell a teacher at school. They certainly can't talk within the family. And so it's just extremely painful. This often leads to drug use in teenage years. So these kids who are sometimes the overachievers, but particularly the kids that are getting into trouble, they find a lot of companionship with other kids who have lived through similar things, and so they find themselves, using drugs, and then the whole cycle starts repeating itself, which is a shame. The good news is that in recovery, once we stop using drugs and alcohol and we start getting some therapy and we start learning about what happened to us as children, we can overcome childhood trauma. We can learn how to accept what happened, even though it wasn't good. We can learn how to put it in its right place. We can learn other skills that allow us to function well. And so recovery can happen, and it doesn't need to continue the cycle. It does take quite a lot of work to overcome childhood trauma, but getting clean and sober is the first step, so that you have clean emotions and clean ways of thinking and seeing the world, and getting help so that you can learn how to deal with this.